Thank you for joining me today. In this video, you are going to learn diagnostic features overview. You will understand the core diagnostic features of a substance usage disorder, include impaired control substance, risks, and the pattern across the substance usage. Neurological underpinnings. You will explore addiction, neurological, focus on dopamine pathway, dysregulation, impaired peripheral cortex function. You will understand the risk factors, identify the genetics, psychological, environmental, and the psychiatric risk factors contribute to the substance disorders, treatment and screen competency. You will learn screening tools, treatment, appropriate, include the pharmacology, treatment, appropriate treatment, include pharmacology, psychotherapy, rational, acute withdrawal management, benzodiazepine reduce the central nervous system hyperactivity, and they prevent seizure during the alcohol withdrawal by acting on a GABA receptor. Alternative withdrawal medications include carbamazepine, fulvic acid. They stabilize the neuron findings, and they reduce withdrawal symptoms. They are suitable for patients with liver impairment. Relapse prevention include naltrexone, which blocks opioid receptors to decrease the alcohol craving and the reward effects of a drinking. Long-term abstinence support asambroxate restores glutamate, gabapentin balance, post-detox, helps sustain abstinence in AUDIT patients. Functional. Methadone acts as a full opioid agonist to prevent withdrawal and reduce craving by steady receptor activation. Buprenorphine safety. Buprenorphine is a partial opioid agonist with a ceiling effect, reduces overdose risk while easing a withdrawal and craving. Naloxone, extended release. Naloxone blocks opioid receptors and prevents euphoria and aid those post-detox. Withdrawal symptoms management. Clonidine and levothyroxine reduce autonomic withdrawal symptoms but does not address the craving. So they don't address the craving. Rationale for nicotine dependency. Phenethylnexine is a partial activates nicotine receptors to reduce withdrawal and block nicotines. Where effectively. Bupian reduce craving by targeting dopamine and norepinephrine pathway and provides antidepressant benefits. Nicotine replacement therapy. NRT derives control nicotine dosage gradually to ease the withdrawal and taper dependency safely. Comprehensive treatment benefits. This medication targets behavior, psychological, neurochemical aspects to increase quitting successful and reducing relapse. Core features of a substance disorders. Diagnostic features. Core symptoms include impaired control, craving, withdrawal, contribute use despite the negative consequence. Social impairment. Substance use causes staining, relationship, work, reduced engagement in a valuable activity, neuroadaptation changes. Addiction reflects brain changes in reward and stress pathways beyond voluntary behavior. Treatment. Effective interventions include motivation, interview, cognitive behavior, and sleep. Neurological of addiction. Dopamine and reward systems. Codeine increase cocaine increase dopamine in the mesolimbic system. Cocaine increases dopamine in the mesolimbic system, reinforces drug-seeking behavior and relapse risks. Impact of stress on addiction. Stress activates the HPA axis, releasing cortisol that heightens craving and sensation reward circuits. Clue-induced relapse triggers. Conditioned drug-related clues causes dopamine surge in the nucleus accumbens. Increase drug cravings. Treatment approaches. Treatment include contingency management, cognitive behavior therapy, mindfulness to reduce relapse risks. Risk factors for substance abuse disorders. They include biological, psychological factors, environmental, social influence, early drinking and neurodevelopment, intervention strategies. So childhood trauma and depression increase the vulnerability to substance usage by affecting stress response and emotional regulation. Environment and social influence. Peer group behavior normalize the heavy drinking, increase the likelihood for bringing drinking into social setting, which is bad, but that's what happens. Early drinking and neurodevelopment. Early onset of alcohol use, drinking for teenagers, higher the risk of long-term alcohol use disorders due to the brain sensitivity. Intervention strategies, screening, trauma-informed therapy, motivational interventions, interviewing are the key for effective prevention and behavior changes. Screening and assessment. Screening tools include AUDIT, CAGE questions, effectively identify harass risky drinking, alcohol dependency in a patient. So those are the assessment tools you can use to assist the patient if they are drinking abnormally. Clinical indication is also could be used. Physiology, tolerance, mild withdrawal symptoms indicate the patient's alcohol dependency despite the functional appearance. So patient maybe look normal, but physiology, tolerance, and mild withdrawal symptoms indicate otherwise. Treatment plan. Liver function test, brief intervention, medication like the naloxone support early intervention and relapse prevention. Alcohol usage disorder. Assessment and prevention. Patient present with tremors, anxiety, tachycardia, elevated liver enzyme indicate chronic alcohol usage. So those are the assessments you can use to assess. Withdrawal management include benzodiazepine treatment that initiate to prevent withdrawal complications such as seizure and delirium tremens. Relapse prevention medications include medication like the naloxone, reduce craving, while prostate support maintenance abstinence. So if you take this medication, prostate, If you take this medication and drink alcohol, you will get very sick. Behavior therapy. Cognitive behavior therapy and motivation interviewing address the coping skills and strength recovery commitment. Pharmacology interventions. Methadone for sustainable stabilization. Methadone, you will use stabilization. Methadone is preferred for patients with high opioid tolerance to support craving, to suppress craving and avoid withdrawal safely. Bupropion can precipitate withdrawal if fentanyl remains due to its partial agonistic properties and high receptor effect. Naloxone is used. Considerations: extended release naloxone naltrexone is introduced post-detox to avoid precipitated withdrawal and support recovery maintenance. Inpatient detox. I used to work inpatient detox. Most often you will use naltrexone to help to support with detox. Agents like clonidine and lovastatin alter the symptoms. Autonomic symptoms include hypertension, agitation, during withdrawal. Psychotherapy and behavior interventions. Contingency management. Uses a tangible rewards to reinforce abstinence behavior. Effective for stimulant and cannabis use disorder. Cognitive behavior therapy helps patients identify and change high-risk thoughts to prevent relapse triggers by emotional discomfort. Motivation interventions address the patient ambivalent and strong commitment by elicit intrinsic motivation to change. So that is, you will encourage the patient. Family therapy support. Reduce environment triggers and enhances supportive family dynamic critically for recovery. Integrated treatment planning. Multimodal treatment strategy integrate usage of medication and therapy, addresses alcohol craving, depression, chronic pain effectively. So you want to treat the chronic pain, depression, craving. You want to collaborate with the primary care for monitoring liver function, pain management, and comprehensive patient care. Supportive and accountability. Refer to Alif Step support group, provides a social reinforcement and strengths a recovery accountability. Holistic patient-centered model. Holistic continuous monitoring approach is essential for treatment co-occurring disorder effectively. For summary, complex nature of addiction. Addiction involves biological, psychological, environmental factors. Highlights it is chronic brain disease. It's brain disease. Screen and diagnosis tools. There is a lot of screen and diagnosis tools. Relevant tools like the AUDIT, DAST, WACA, COWS, helps assessing addiction severity and withdrawal risk. Pharmacology, treatment. Medications are tailored to substance types, include alcohol, opioid, nicotine, to support the recovery. Behavior interventions like cognitive behavior therapy, motivational interviewing, family therapy provides essential behavior support for long-term recovery. Thank you for joining me today, and please prescribe. Thank you.